Hello everyone, once again welcome to my OET channel. Today we will have a OET role play section. So we will have one role play card. It is happening in community health center. One patient came to see patient with light chest pain. It's like a mild chest pain and anxiety, and the doctor is advising him to have a electrocardiogram to the community health nurse. And we are working in that clinic, and the patient is coming to us for electrocardiogram. Before proceeding to the procedure, this is just like a discussion scenario. We are explaining what is a procedure and what is the benefit of the procedure and how long it will take, and patient's anxiety and the reassurance. These are the scenario of this role play. So we will have the role play sections, how we will present the how we will present the role play, because it is an unknown scenario. But the patient came to GP's clinic. We are working there, but we don't know the patient before, so it's like an unknown scenario only. But this patient is referred from your GP, where you are working. But we will have a discussion regarding the procedure completely, and it will end up with the just before the procedure scenario. Okay, let us see how the role play will go. Firstly, we will see the role play card. Here you can see the settings. It is community health center, and the nursing role play. There is one paragraph. Always you have to give more importance for this paragraph. So from here you will get exactly the role of a nurse. That means your role. You see a 50-year-old patient who has been referred for an ECG electrocardiogram because of chest pains. You explain the procedure to him or her before beginning. So how we can start here? So this is a unknown scenario. You can see the first part, confirm the reason for patient's visit. So when you are reading, when you are utilizing the 3-minute preparation time, what you have to do, just have a look, quick look, and you can just underline the important points, because in one task you will have more subtasks. Example, here you can see that we have totally 6 speaking tasks, but inside each task you will have 2 or more subtasks. So sometimes interlocutor may ask you some questions not in arranged manner, not in an organized manner, so you will skip some of the subtasks. What you can do, just you can underline the main parts, the main topics. Example, confirm, you can just underline confirm reason. Okay, then for ECG, then when you are doing the role play, it will be easy for you to have a quick look and you can explain. So confirm ECG. Then find out how patient is feeling now, chest pains or anxiety, etc., and whether he has had ECG test before. So you can just underline find out, then chest pain and anxiety, then had ECG before. So just in that way. Then next one, explain ECG procedure. You can just underline the ECG procedure. That's enough. Then removal of clothing from waist up, need to be lie almost flat. Attachment of electrodes to arms or legs, chest, connection to ECG recording machine, printed graph or heart activity. So these everything it will comes under the procedure. Then completion in a few minutes. Okay, that's fine. Then the next one is the request to interpret ECG results. Outline results process. That means immediate analysis of graph by doctor, discussion with the patient, etc. So you can imagine that in that sentence there may be a question from patient, so you have to ask question, do you have any concern? Then patient may tell you, do after the procedure you will explain me sister, like that he may ask you question. Then you have to tell that no, it's from the doctor. Then reassure patient about ECG, painless, possibility of sight discomfort during removal of electrodes, etc. So this is regarding the procedure. Maybe he will ask you some concern about the procedure. Then you can just underline reassure patient, line painless, slight discomfort, like that. Then the next one is explain function of ECG. So you can just underline the function, so you can read it's like continuously. Then the last one, jewelry, you can just underline patient wearing jewelry or no. Last one is the consent. So like that you can make a underline, so that it will be easy for you to have a quick look upon when you are doing the role play. So we will start the role play. Firstly, we will start with the introduction. So we can start. This is an unknown case. So we can start like, good morning. I am Rashmi Rajit, one of the registered nurses working in this community health center. How may I address you and how can I help you today? Then the patient will tell, good morning, sister. My name is Robert. And actually, I came here with the chest pain. I have mild chest pain. So I have seen my GP. He told me to come to you for some procedure or something like that. It's like ECG or something like that. Then we can tell out that. So the first task is confirm reason for patient visit ECG and find out how patient is feeling now, chest pain, anxiety, and whether he had ECG test before. So the first task we will start like this. Well, Mr. Robert, no problem, I can do that. Before proceeding further, let me check your name in my system. Okay, fine. So your GP has advised for electrocardiogram test, isn't it? Before proceeding to the procedure, I would like to ask you some question. Is it okay for you? Then he will tell, okay, fine, no problem. Then we can ask, now, how are you feeling now? Do you have still chest pain? And you look so anxious, isn't it? Then he will tell, no, sister, I don't have much pain. Now the severity has reduced, but I'm a little bit anxiety about my condition. And we can ask, no need to worry, Mr. Robert, you are here with our safe hands. We are here to help you. No need to worry about your condition. Then we can ask, I would like to ask you whether you had ECG before. He will tell, no, sister, it's the first time for me. Then we can tell, well, Mr. Robert, since it is the first time for you, I will explain you the procedure. First, we need to remove the clothing from waist up, and it is essential for you to lie down almost in a flat position. We will attach the electrodes to your arms, legs, and chest. Then we will connect you with the ECG recording machine. Then the process will complete within few minutes and the printed graph will come outside. With that graph, we can see the your heart activity and if there is any abnormality. I can reassure you that it will not take a long time. In a few minutes, this procedure will finish it off. Are you getting my point? We can ask like that because we are explaining something and we have to get the feedback whether it is clear for them. Then they will tell, the patient will tell, yes, sister, it is clear for me. Then we can tell, do you have any concern about your procedure? Then he may ask you whether, sister, after the procedure, you will interpret my ECG result or whether you can tell me the report. We can tell, Mr. Robert, I'm so sorry to tell you that I am not a concerned person to interpret your ECG result. But no need to worry. After the procedure, I will give you the graph. You can go and meet with your general practitioner. Of course, he will discuss with you regarding the graph and if there is any abnormalities. So is it okay for you? Then the patient will tell, oh, okay, it's fine, no problem. I will have a consultation with my GP again. Then we will ask, still you have anything to be clarified? Then he will ask, sister, whether it is painful procedure because it's the first time for me. Then we can tell, I can truly understand your concern, Mr. Robert. No need to worry. Actually, this ECG is a painless, but there is a possibility of slight discomfort during the removal of electrodes because we will fix these electrodes with some type of gel. So it will attach with your skin closely. But don't need to worry, this is a light discomfort only. It will relieve within few minutes. Are you okay with that? Then it will finish. The next one, explain the function of ECG. And then we will tell for you. Then we can tell for your further information. I will tell you something regarding the function of ECG. May I proceed with that? Like that, we can ask. And then he will tell, of course, sister, just I can, you can. I will. I am ready to hear. Then we can tell. Actually, this is mandatory for you, Mr. Robert, because you have chest pain, right? And it will measure your heart rate, any irregularities, and any palpitations, so something like that. And after this procedure, your GP will inform you regarding the if there is any abnormalities, and depend upon this result, he can take the decision about your further treatment or if there is any other procedure. So, are you getting my point? Then it will be clear off. Then you can tell, before proceeding to the procedure, I would like to tell you something, Mr. Robert. Please remove any jewelries or if you have mobile phone with you because it will interfere with the report. Then he will tell, no, sister, I don't have any jewelries and my phone is in a car. I didn't bring it here. Then we can tell, oh, it's well, it's okay, fine. Then at the last, we have to ask, do you have any other concern? They will tell, and he will tell, no, sister, I don't have any other concerns. Then you can tell, Mr. Robert, I hope I have cleared all your doubts. And if nothing is left over, may I proceed with your ECG? So that is the conclusion here, because the next step it is you are going to do the ECG procedure. So within that, we can wind up the role play. So in that way, we can do the role play. Actually, it is nothing but everything will be given in the case, not just you have to put something in the starting and you have to close with something in the after the conversation, and you have to ask something to the patient. So nothing but you are the one leading part, and you are the one will start the conversation and you are the one will close the conversation, but you have to involve the patient in between. So that's all the thing. And if there is some pauses, no problem, but you should not have a long pause, but you can have a short pauses, it's okay, fine. And about your language or slang or something, it's fine, no problem. Anyway, we are not the English speakers and we are not native speakers, so it's fine, it's okay, fine. What all things you are presenting, it should be in a clear way, and there should be there should not be much grammatical mistakes, and you can present in a polite manner, and of course there should be a reassurance in each and every way. I mean, it's not mean that every line should be reassurance, but throughout the role play you have to give the reassurance, even if you are telling something, it's like a bad news, or it's like something like a complicated one, like a complication, you can tell, it's like, I'm so sorry to tell you that, in that way. So everywhere there should be a polite manner and reassurance should be there. So I hope it is clear for you, and you can practice in the same way. And in my Telegram group I have posted a mini recent OET roleplay card, so that you can download, take a printout, and practice in the same way. Okay, thank you. We will see you with another one interesting role play. Until then, bye, take care.